Moving on to beta blockers. Now, this class of medication is very important. You'll see them throughout the NAPLEX and throughout several other disease states. So here are a couple of them. I would recommend knowing their brand and generic name and a couple of their characteristics noted on the slide. Here are the rest of the beta blockers, and I just wanted to note out for the NAPLEX exam, a high-yield question is usually about carvedilol, Coreg, where they could ask you whether it's taken with food or not, and usually the starting dose for CHF and hypertension. Usually the question will look something like, the pharmacist wants to start carvedilol for a patient with CHF. What is the starting dose for this patient? And they could give you the CHF dosage, the hypertension dosage, which will be 3.125 BID and 6.25 milligrams BID, and a couple other dosages, and it will be up to you to know the starting dose for each disease state. So beta blockers could be further categorized into B1 selective, which stands for beta blockers that are more selective towards your heart. And a good mnemonic to know for these are AMEBBA. So I would memorize these for the NAPLEX exam. And a good way to remember the differences between each beta blocker and its where it works is B1 works on your heart, and you can think of it as the one indicating that you only have one heart, while the B2 selectively works on your lungs, and you have two lungs. So the 2 could be a reminder of the beta blocker working on your lungs. Another category to divide beta blockers into is the beta blockers that are available in IV formulation, and the mnemonic for these is me. Next, we have a group of beta blockers that have intrinsic sympathomimetic activity, ISA activity, which don't increase resting heart rate, and you can memorize these as ACE, PIN, PEN. So we'll be seeing beta blockers throughout this course, so it's important to know beta blockers indication, and a good mnemonic for this is PASS, which is post-myocardia infraction, which is a heart attack, angina, AFib rate control, and for CHF, systolic heart failure. Beta blocker side effects could be memorized through the mnemonic of blocker, get it, beta blocker. The B standing for bradycardia / bronchospasms. L for lipid increase and libido decrease. O for orthostatic hypotension. C for conduction abnormalities. And the K, we know constriction starts with a C, but just go with it. So K standing for the constriction of peripheral vasculature. E standing for exhaustion / emotional depression. And lastly, R standing for reduced recognition of hypoglycemia. And it could also cause hypoglycemia.